Okay, good morning. It is February 28th. Thank you all for joining us today. I'm Erik Geizer. I'm here with Josh Christiana. Today we're going to talk about our quality improvement program, where we are, where we've come from, and where we're going, and also outline some of the requirements that will be upcoming in the next month or two in terms of metrics and quality improvement plans.
Hi everybody, this is Josh Christiana, as Erik just mentioned. Thank you for joining us this morning. So we are a few years into our collection of the data and the metrics, and it's pretty easy to be overwhelmed with some of the data, or you can become overwhelmed with it. So part of today's presentation is to discuss how we're going to use the data, how we can make sure that it's meaningful and efficient, and some of the revisions that we've done to get it to that point. So just a few things about the webinar. We are recording it, and a link will be sent to the participants following this presentation. If you have questions, please ask them in the chat box, and we will try to leave some time so that we can actually answer those at the end. And I apologize, I mean the question box, not the chat box. And again, we're going to try to answer those at the end of this presentation.
If for some reason we don't get to your question, or we haven't answered it to the best or to your satisfaction, you all have our email address, and you can email us or call us as well.
So we have a few objectives for today. Primarily, we're going to talk about the progress of the quality program, and as well as some of the changes that we are going to be putting into place for 2017. We'll look at the future of the quality improvement program, which includes both the short-term and the long-term goals. But before we do that, we'd like to just give a thank you to the Quality Standards Professional Workgroup, who has put a lot of effort into the program over the last few years. So these are the members that have helped us get to the point where we are and continuing forward.
And there's very little that we do in terms of the metrics that we don't run by this group to make sure it makes sense, to make sure that the information we're requesting is available. We're trying not to duplicate the work you have to do at the chapter level. So it's not just me and Josh in some ivory tower making this stuff up. We're running it by this whole group, and we thank them for all their help.
So now we're going to talk about the progress that we've made over the last year on the quality program. So in March of 2016, we actually finalized the quality improvement manual. It was the first one that we've ever had, and we did end up posting that on NYSARC's website. You can register right to the website and go into the chapter portal under the quality section, and you'll find the manual in there. And Erik's going to cover the manual a little bit later in the presentation, including the updates that we've made. We did refine the 2015 metrics based on the Quality Standards Professional Workgroup feedback, as well as feedback from the chapters and execs. It was the first year that we did metrics analysis involving CQL accreditation, which was an interesting task, and it produced some interesting results, which we are going to look at. Also, first year that we explored CQL POMs database use, and the second year that we released identified data, which was something that the executives had asked for, so we satisfied that request. We continue to look to do that for this year. And then also, we continue to refine the data dictionary, the indicators, the formulas, and the manual. Erik's going to look at that stuff in later slides, mostly based on the assessments and the quality standards work group. And then we did our first formal survey on the quality improvement program during the year. So we got some overwhelming responses that showed that generally things were positive. We had an average performance across the responses that was 4.36 out of 5, and we continued to get information from other chapters and asked them what else they thought we could improve on, and they said, getting further information from different chapters would be helpful. There was a recommendation made for real-time data collection, which is something that we're working on right now. We're looking to build a platform to include and allow for this to occur. And we also are discussing the recommendation for a process for sharing best practices and successes. We'll be doing this at the upcoming regional meetings in the spring. Hopeful to either have a centralized location where everyone can share the things that they're doing in terms of their quality programs, some of the things that are in your quality improvement plan, some of the things that you're doing with CQL. All of those things will be helpful to your program.
We're really hoping to fashion it like we've done on the compliance side. We have, I believe, 10 or 11 audit tools that are now out there that are available on the website. And we're hoping to also start a catalog, if you will, of quality tools that chapters will be able to use as well.
So some general response themes. Generally, we found that the chapters responded that they were pleased with where we are in terms of the metrics. Most of the comments were that the metrics are useful and informative, mostly used to build the quality improvement plans and to provide feedback to the board, to the executive, to the leadership teams. Also led to chapters asking the question why. So doing a lot more exploration of, why do we do things the way we do? How can we do them better? How are we changing? And then also we did receive, one of the concerns that we received was about the data overload that I mentioned earlier. And we're attempting to address this through refining the metrics and trying to weed out the ones that, we looked at and said, well, these are really not providing any real meaningful data for you to actually use and to act on. Like an example being that we removed other mistreatment from the incident metrics because the feedback generally was that other mistreatment is a category that is very broad and applied very broadly by the Justice Center and others. So it's very hard to get meaningful data out of that.
Some other feedback that we received, which is very helpful, is we have heard from executive directors, we've heard from compliance and quality folks, some questions about how we have defined some of our metrics, and we take those very seriously. We will be discussing some of those considerations in the course of today's presentation. And just to follow up on what Josh said, we send out, 10 or 11 or 12 spreadsheets with a lot of data and information in there. And we can't always predict which of those metrics are going to be most important to your chapter. So that's something you have to manage on the local level. We don't want to filter it at our level because it might be important to another chapter, but we can help you navigate that amount of data as well.
So this is the quality indicator dashboard. We've sent this out 2 years now in a row, and last year we made some modifications to it. You'll see the 13 indicators that existed in 2015 that we reported on, and the dashboard on the right-hand side. One of the additions to the dashboard last year was the comparison of a 2014 number and a 2015 number where those existed. So for some metrics we didn't have numbers from 2014 because we weren't capturing them, like staff turnover. But others we did actually have 2014 data. So the SODs, for example, we had that, and we sent it out in that manner so that chapters could not only look where they were year to year, but then put in their own specific data and then compare it to the actual ranges and the averages. So now we're going to discuss CQL a little bit and the progress that we've made with them. As of January 2017, 40 chapters were accredited. This is a tremendous achievement for NYSARC, for the chapters, something that we're very proud of and that we've discussed with CQL at length. CQL did conduct a webinar in October, and that was as part of our continuing MOU with them, which they've agreed to produce and present 2 webinars to us on an annual basis. We did have some really great things occur last year in terms of data that was available to us. So for the first time, we received CQL and NYSARC aggregated POMs data. We also had national and statewide POMs data averages and an inventory of chapter CQL database access. We actually ended up sending this out to the chapters, and we have that data. If anyone's interested and they haven't seen it or they'd like to, please reach out after the presentation. And the webinar that was conducted is actually up on NYSARC's YouTube page, which we will send out the link to that following this presentation. So a little bit more on the database. Now, before I touch on some of these, I just want to point out that CQL is currently working on an update of their database and making revisions to help, produce more reports, make the information that's inside of it more meaningful and the access more user-friendly, because that was a concern that was raised to them. But the database includes over 20 years of national POMs data. 19 chapters had access as of the October presentation, and there were over 500 interviews that were entered into the database as of that October presentation. So we did have some data that we could look at. Not a large amount, but enough that we could look at and see how the system worked, what reports could be run, and again, CQL presented on that in their webinar. We are looking to purchase a organizational membership. That membership, the goal will be that it would allow us to look at the data in a more global view and produce some reports. The data, the way that CQL is explaining it at this point, the hope is that you'll be able to slice the data into different reports and do some comparisons across national, statewide, chapters, a few different things. A key piece of this is that we are not mandating the use of the POMs database, but we're just expressing the benefits to it. When a chapter becomes accredited, they do gain access to the database, and there are some significant benefits to having access to it and being able to look at where you are in terms of relation to the national and statewide numbers.
This really, I guess, just to echo Josh, this is really, I think, like Josh said, we're definitely not pushing the use of the CQL database. Obviously, if you have a homegrown system that you're using to collect your POM data, that's great. The key is that, I guess one weakness we're seeing is that we have 40 chapters out there who are accredited, who are doing this sort of work, who are collecting the POMs data, and then we're seeing kind of a drop-off. We're seeing that they maybe aren't using their POMs data to enhance quality on a systemic level. Are they looking at averages? Are they looking at how they compare to other chapters or other provider organizations? And that's where I think we're falling a little short. So a key out of all of this is not necessarily that you have to use this database, but you need to use some sort of mechanism to calculate your scores, identify where you're falling short, implement corrective actions and a quality improvement plan, and try to bring scores where you're lower up to where you would want to see them.
So as I mentioned, there are some benefits of the POMs database that exist now. This is again based on the current model, which once CQL finishes their redesign, which is anticipated sometime by the conclusion of spring, then they are going to hold a webinar for the chapters and go over the database and the updates and what it looks like. But right now, it allows for the completion of the interview tool directly into the system. The tool is in there, and then also it can produce I believe, a PDF version of it. So that makes things a little bit more efficient. The system can track all sorts of data from the POMs, and from that you can generate reports with various filters. Things like splits across the different outcomes, whether an outcome is present or a support is present, and then also across service location. There's a few different things that can happen. The goal here should be, if you're using the POMs data, that you can use it to help identify where you should be putting your resources. Everybody has limited resources, and right now, you're using them on various quality improvement activities. but the POMs and an analysis of that can help you identify maybe this outcome, is not present, but we can put some more resources towards the supports and help get to that outcome.
You can also use the data to really drive quality improvement. So for the example in the middle of the page is to filter by service location. So if your scores are lower in one of the personal outcome measures, you can look at the scores across all of your service locations and see if one of those areas is driving down your totals. You can actually use POMs data to be a management tool and identify where some of your programs might be falling short.
One of the other nice things is that you can actually pull the data into an Excel spreadsheet, so it doesn't need to stay in the system. You can pull it out, then you can start, converting the data into forms and formats that you want and reports that you want. And then the last thing is that it just rounds out that program. It just adds to the things that you're already doing. Our quality improvement program includes, the plan includes a piece about the satisfaction of the individuals, so the POMs is generally something that a lot of chapters are using to measure that. This is just an example report back from when we collected the data we looked at the data in October. You can see here that you can look at the outcome being present and the supports in place. This one's for natural supports. It was based on about 600 or so interviews that were conducted, and you can see that for the purposes of this, the 66% of supports were in place and 55% of outcomes. But again, if there was a large amount of no to the supports, you could look at that and go, well, okay, maybe I need to put more resources towards developing natural supports and assisting in that area. This is the aggregated report that we sent out last year. It's based on data from January 15 to April 16, and generally speaking, we exceeded national and state averages in many areas, and it looks like, for the most part, that we were improving over the years. But there are still some opportunities for improvement, and we found those to be in the areas of integrated employment, being present, people realizing their goals, and interestingly, these are really connected to the overall statewide goals in terms of person-centered planning and the HCBS settings rules. A lot of that's the areas that we need to work on align with those. We also released the first time ever Quality Indicators dashboard, where we did a little comparison of chapters that were accredited prior to prior to December 31st, 2014, and those that were still getting approved and accredited. And as a positive here, we really came out, ahead on most categories. The couple that we still had some room for improvement on were a percentage of individuals that are employed at a work age, employee injuries, and staff turnover were the three areas that there could be some improvement.
To one point on this slide, if you look at the accredited chapters pre-2015, there were just 19. So as Josh said earlier, we now have 40 chapters that are accredited. So we're going to get more and more and more data available to us. So we're, to be in the interest of transparency, we're kind of data geeks a little bit, and we are very interested to see if these trends will hold up and show improvement in chapters that are accredited versus chapters that aren't or are in the process. It'll be an interesting thing to learn this year.
So we've discussed this previously, but there is a distinct connection between the basic assurances and the work that you do with your quality improvement program and your plan. The basic assurances requires a monitoring as part of Factor 10, and also a comprehensive plan that describes the methods and procedures that you're going to use to monitor the basic assurances. And our quality improvement plan has elements that mirror some of the basic assurances. And we actually have in the quality improvement manual, starting on page 16, a crosswalk that looks at the basic assurances to our indicators. And if you use that and you use it with your basic assurance monitoring, you can really kind of satisfy two things at once and avoid duplicating work. And then the last thing on CQL is really just the next steps that we're looking to do. So we have a long-term goal to become the first organization to have all our chapters and divisions accredited, and we're well on the way. We continue to look at the MOU, which will be updated in 2018. We hope to do a second-year review of the impact of CQL accreditation on our metrics, and a continued analysis of the POMs data that is submitted by the chapters, as well as having additional CQL webinars, including one, as I mentioned earlier, on the updates to CQL's POMs database.
Okay, let's talk now about the changes that you're going to see in 2017, and we'll go through some of the submission dates of importance. First, I just wanted to start with a 45 and 60-day letter update. We don't get many of these, but when we do get a 45 or 60-day letter, it's typically a pretty serious matter that the state or the feds have found significant deficiencies that raise health and safety concerns. We did revise the chapter manual to require that if you get one of these letters, we hope you would call us, but we are requiring that you do within 5 business days so that we can be made aware. The goal is to be able to assist you in developing a plan of corrective action. We're also required to do a site visit. We're not going to do a site visit when the state is there. We're going to try to be as unobtrusive as possible. But we do need to come and make sure that you are on the right path to fixing whatever deficiencies were identified. So just please keep that in mind. If you do get a 45 or 60-day letter, please reach out to us, let us know, and send us a copy of that letter so we can help you address whatever the problems are. As we're speaking today, the new 2017 manual for quality improvement is being posted up on the website. Should be there, I would say, either later today or perhaps tomorrow, certainly by the end of the week. So there are some changes in the manual. Some compliance reporting requirements have changed, like the 45 and 60-day letter requirement, that has changed. The quality indicators reporting form, that's the form you guys submit to us every year with data. There have been some changes. We've streamlined that a little bit. We've made a few modifications to the data dictionary, which I'll cover in a slide or two. And then some formulas have changed as we have received feedback on ways to make the metrics more valid. Here's the form that you'll all be getting this year, and we'll be asking you to submit. It's actually streamlined a bit. We're asking for 20 data points. I think last year we asked for 23. Some new ones, if you can, I apologize, some of the slide might be a little small, but P10 and P11 are brand new, and I'll talk more about that, but we're trying to get at DSP vacancies because we think that has a big impact on quality at the chapter level. And we made some changes to the incident metrics as well, eliminating some that didn't really provide much meaningful data back to the chapters. First, I want to start with your quality improvement plan. So all of you know that every year you have to have a quality improvement plan in place. It has to be approved by the board. Originally, when we started this, I think in 2014, we were thinking we were going to have chapters submit their full quality improvement plan every year, and we realized that that was going to be an overwhelming task for us to try to review these things, provide feedback. So what we did with Josh here on board last year was we created an attestation form where you can basically say, we have a plan, our board has approved it, here are the major changes, and we'll just take those forms, make those notations, and then every 3 years or so we will ask for a full submission so we can review your quality improvement plan. And I think we're going to be doing that either at the end of 2017 or the beginning of 2018 to see how chapters are progressing. So the form can be completed electronically and submitted via email, and the form is part of the quality improvement manual that was on the previous slide. This is what the form looks like. It's a fillable form. You can do it in electronic format. We're not asking for a whole lot of information, just the key things, what chapter, what material changes have been made since the previous year. Did the board look at this and approve it? And then, we'll obviously review the form here and make a notation that it has been submitted and that the chapter is in compliance. So the schedule for the QIP attestation form and the quality data reporting is going to be April 30th this year. We moved that up a few weeks. I think last year was towards the end of May. We're trying to balance giving you enough time to do your Part 624 analysis, which we know happens in the first quarter of the year, with the need for us to get the data, analyze it, and get it back to you in a timely fashion so that it's meaningful for you guys. So we did move it up a few weeks. We think we'll be able to have most of it by this date. If for some reason you're not able to meet this date, please call us and let us know. Obviously, we can be somewhat flexible if you're unable to get it for whatever reason. And we hope now that we'll be getting it by April 30th that we'll be able to give you feedback at the beginning of the summer, maybe late June, early July. I think last year it had to wait almost until August before we actually were able to give you back the data. So again, we're trying to give this to you in a more timely fashion so it's more meaningful.
And just on that point, this was part of the survey response recommendation to move the date up for all the reasons that Erik mentioned, and to just make sure that we are providing it to you in a timely manner that allows you to actually make necessary adjustments to your plans.
Okay, so here are some of the changes. So as I said, when I pulled up the data reporting form, there's 20 data points in 2017 versus 23 in 2016. Some major changes, and I say major changes because there are a number of minor changes and slight definitional changes that you probably won't even notice. Most chapters we're doing it the right way, but we made things a little clearer. But the major ones are that when we ask for your counts of unduplicated individuals, we are now going to exclude clinic-only services. So if you have individuals that you serve at your clinic and only your clinic, we are not going to count them in our unduplicated counts. Reason we're going to do that is because there are some chapters that have huge clinic programs where they just serve people maybe a few times a year, once a year for physicals, things of that nature, and it's really skewing their data pretty extensively. So by eliminating the clinic-only services, we think our data will be more reliable. We also believe that most of the people that are coming to the service will be captured in other buckets, such as residential or day hab. So we think that we just think it'll be more valid, and this was something that the committee agreed to. We're also going to look at the DSP vacancy factor, and that's on the CFR, the 200 codes. You can coordinate with your financial people to get that data. But basically, we're looking for your vacancies for your 200 codes and your budgeted 200 codes, and we're trying to figure out how many openings do you have, as we think that that's an indicator of quality. Furthermore, we heard back from chapters that their Access VR extended services and the people they have assisted through that program in getting gainful employment were not being counted in the competitive employment totals. So we have added that back in, and you certainly can count those individuals back into your gainful, competitively employed metrics. We do have an updated data dictionary that will be sent. It's also a part of the quality manual, which will be posted on the website. And I think we're also going to send out a copy by email, probably at the end of this week or early next week. Some other things that we did is we got rid of some non-essential demographics, stripped away things that we weren't even using in our formulas to try to make it a little easier for you guys to complete. We didn't make any changes to our SOD indicators, number of surveys that you receive. number of statement of deficiencies that you get, except that we did make it clearer that SODs does include your OFPC surveys. Okay, they are not separate and distinct. They are to be counted in your SODs. They are an SOD and they are done for OPWDD by OFPC. So they still count as an SOD. We also removed from our incident counts notable occurrences, as we just didn't find that they were telling us much of anything. We took away mistreatment and substantiated mistreatment. We got a lot of feedback that just didn't make a lot of sense and it wasn't meaningful to the chapter. So we're really focusing in now on abuse and neglect, both allegations and outcomes. The removal of mistreatment, and just a reminder that if you have a case where there are multiple substantiations, let's say four allegations get substantiated in one case, we would just count that as one substantiated case, not four substantiated cases. We don't want to see your numbers impacted by calculating that the wrong way. Staff turnover. We had this last year. There's a slight change in the definition, but basically we're looking for the number of staff who have exited the agency during the year. The definition we have been using excludes interns, relief, substitute, and per diem. And we did receive a lot of feedback on this particular metric from chapters asking us why we were excluding those particular categories of employees. The reason we made that decision originally is because inherently in those positions there is a lot of turnover. So we felt that it would artificially inflate your staff turnover rates. The argument, though, can be made the other way too, correct? Like if you rely a lot on those staff, you know, shouldn't they be counted in to the totals, and wouldn't they also have an impact on quality as well? So we are thinking of broadening this a little bit next year, where we would have two categories, this definition that you see before you, and also one that would include the relief, the substitute, and the per diem. And then you can kind of use, based on your particular staff portfolio, your staff makeup, you can use the definition and the metric that makes most sense for your particular chapter. A new indicator for this year is our vacancy factor. The definition, as OPWDD has defined it, it can be found in ADM 2014-03. I think that's the core competencies. So on that form with the yellow and the green that you'll be submitting by April 30th, we'll be asking for the number of vacant FTE DSP positions. And those will be your CFR 200 codes. You'll probably need to work with your HR and finance teams, make sure you have the correct number. But we're going to be looking at vacant DSPs over your budgeted DSPs. And again, all CFR 200, all as of December 31st. So a snapshot of your vacancies on December 31st.
And there was a significant amount of conversation with the work group on this factor, or on this indicator. And the reason we started with DSPs and focusing there is just because it was agreed that that is really one of the most critical elements of quality of care and service is the DSPs. So we were going to start there and see what the vacancy looks like in those areas.
On a broader scale, this data will also help us in terms of our advocacy work. Knowing our vacancy rates in direct care positions across the organization and by chapter gives us a sense of the crisis that we're in, and we can use that data to advocate for additional monies, additional positions, and additional support through our regulatory agencies and through the political landscape. Here are the formulas that we will be using this year. Again, you can just refer back to the sheet that you'll be submitting to us to see what metrics are what, but you can calculate your own formulas, and in a way it works well because you are our quality assurance team. If we make a mistake, I don't think we make many, but if we do, you'll let us know that the numbers aren't matching your numbers. But you can see here there's about 11 or 12 indicators that we will be reporting back to all of you in a number of different ways. We might do from year to year to see how we're trending over time. Obviously, we're going to do intra-chapter, inter-chapter, so you can see how you're comparing to other chapters. We're also looking to maybe roll out some regional rates so you can see how you're doing relative to other chapters in your region. And with the change to the regional makeup of NYSARC, that will obviously take a little bit more work this year, but we think it'll also be very helpful in assessing where you stand.
So now we're going to talk a little bit about where we're headed and the future of the quality improvement program. So, we can't really get a lot done if we stay complacent. So that's why there's, consistent review and refinement of the metrics, of the all of the things that we're doing in terms of CQL. So there's constant movement, constant flow in the process. And as part of the 1915C waiver amendment that OPWDD put in to CMS, they included that they're committed to CQL's POMs approach. And their intent is to have their DQI staff be trained on this approach and use it to assess the HCBS settings. So really, the chapters that are utilizing the POMs approach and the data will be better prepared for the future of quality improvement activities. So it's just something to consider as you're looking at how you're assessing the satisfaction of the individuals, and if you're using POMs or you're using another method, just that OPWDD has essentially adopted this method. And again, this just sort of further reiterates that OPWDD has publicly embraced CQL's POMs as the person-centered quality of life measurement. According to OPWDD's report into CMS at that point, there were 54 provider agencies who have chosen to seek CQL accreditation, with 11 in process. That was as of June 16. But as we mentioned earlier, we have 40 chapters who are accredited now, and
41. As of this webinar, in real time, we're able to report an additional chapter. I believe our Oswego chapter has become accredited.
So 41, and it's breaking news. We should have a little breaking news tickler there. But so now we're up to 41 chapters, but we make up a large portion of the CQL accredited provider agencies. So there's, we have a lot of potential here for, movement with OPWDD, and also when DQI is looking at your sites, that portion should be taken into consideration. So we are working on some enhancement of how we track and report on SODs here at State Office. So one of the things we're doing is we're working with OPWDD's DQI to have all their SODs sent directly to a dedicated email to us. Right now they send them in from their different regions, and we get them in, sometimes a month after they happen, or 3 weeks. It varies, but we're looking to centralize that. We have a few goals, which one of them we've actually already achieved. This is the alignment of the SODs that we're collecting the data on with the DQI survey redesign from October. Many of you have gone through this process, and I thank you for sending me your feedback on that. And you're aware that there are tons of indicators in the new redesign that you could potentially get a deficiency on. But we've now aligned our data collection with that new site survey process, so we can get the most current information and provide it to you. We're also looking to automate the data analysis. We are finalizing a program right now where we can hope to run periodic reports on things like the number of deficiencies by a particular standard, by a particular chapter, in regions. We really can slice the data a few different ways. And then hopefully increasing the interval of reporting to you on trends in SODs. And we really have been doing this right now through our compliance and quality alerts over the past few months. I sent out, where we were, month to month in terms of the deficiencies that we've received. So hopefully that's been helpful to you. And then the results will be continued to be reported on in an annual year in review webinar, which we hope to have sometime in the summer. We also have made some modifications to how we track and report deaths at State Office. Really, it's just, again, more automation of the data analysis, increasing the availability of data for you per your request. So if you're interested in, if there's trends in your own death reports that you sent to us, we may be able to give you some more information. And then putting this data into buckets such as the manner of death, the immediate causes, have there been acute medical conditions within 90 days, or end-of-life decisions made. Now, we do acknowledge that death data is a bit more challenging than the others that we collect because it's not always easy to tell what that data actually tells you. Without going really deep into the data and looking at really chapter-level trends.
All right, so we're really using, we're filtering. Obviously we're less concerned with a 75-year-old medically fragile individual who passes away than someone who is in their 20s or 30s who didn't really have any significant medical conditions to be concerned about. So we are filtering it that way, following up with chapters occasionally on deaths that worry us as we review them here. But Josh is right. Simply looking at number of deaths doesn't tell us much of anything because if you have an older population or a medically fragile population, you're going to have more deaths in other chapters.
And one of the things that this has done, actually, the changes, it has allowed us to be a little more predictive in terms of when we believe the Justice Center will actually do a closer review. And this has come up because we do look at things like deaths where there's been a choking episode prior to the death, or a bowel obstruction, or some sort of issue with dietary. But we are looking at those things and able to work with the chapter to say, okay, this is one of the cases that the Justice Center may be interested in, and help predict what might happen next. So we have some short-term steps that we'd like to take. Again, rolling out the 2016 data reporting changes, as Erik mentioned, we're going to get those out, the ones that we looked at today. Sending out the quality manual, the quality improvement attestation form, the data reporting forms, those will go out hopefully in the next few days by the end of the week. And then again, we'll need the attestation and reports back by April 30th. They can again be sent in by email. We'll keep track of kind of what we receive, and we'll offer you feedback. Last year when we would get them in, we would go through the data and see if there was anything that was glaringly unusual, and reach directly back out to the person reporting and see if other information had to be provided. And we'll analyze the data and provide feedback sometime in the summer, like we do every year. One other key point here is that we are approaching the Quality Improvement Plan 3-year update. So the current chapter manual addresses that the QIPs are submitted by each chapter pursuant to guidance and under the terms by the Joint Committee on Quality and Corporate Compliance. And what the committee has requested and what we are requesting is that the quality improvement plans, I think we can go to the next one, the quality improvement plans are reviewed and revised every 3 years or as significant changes occur. So we're going to be looking to get updated quality improvement plans from you at the end of 2017 into the beginning of 2018. So, as I mentioned, hopefully that'll be starting in the fall. The work group will review each of those and provide feedback to the chapters. Now, this is something that happened in the very beginning of the quality improvement plans. The first round of plans were reviewed, feedback was provided, so we hope to do that again. Now, if you would like feedback on your plans, you're more than welcome to send them to us outside of the 3-year requirement. In fact, some chapters have done that, and we've reviewed those plans and offered feedback to them. Because we have all of the plans, from the beginning, and then we have some in between, we're able to look at things that other chapters are doing and offer some valuable feedback on that. So Erik's going to talk a little bit about the long term and what's next.
Yep. Okay, so as we spoke today, we're going to continue to explore the CQL database, but the more important message is that if you are accredited and you are collecting POM data, use it. It's there. You've spent a lot of money, you've invested a lot of time and resources and effort in getting accredited and doing these interviews, and that is probably your best vehicle for collecting customer satisfaction data are those interviews. So use that data, pull that data into your quality improvement plans on an annual basis, just like you do with your Part 624, your trend analysis. You should be doing trending with your POM data as well. Josh and I are going to continue to work with a consultant here to develop a web-based portal where you can just input your data right into the portal and hit submit versus doing it by paper and email, which will make life easier, we hope, for you and for us as well. We're going to continue to add materials to our website, just like we have on the compliance side. So best practices in terms of quality improvement plans, all that stuff is hopefully going to be posted to the website. Again, we continue to finalize the vital few indicators. Those are the indicators that we think really do speak most directly to quality. I think right now we've kind of agreed on 3 or 4 that we think are more important, and those would be like your staff turnover, your DSP vacancy rate, your abuse and neglect substantiations, and the percentage of surveys in which you're receiving an SOD. Those, I think, are pretty telling metrics that we want to focus on. And I think our strategic visioning work group is also going to be focusing on those 4 metrics right now as well. And then down the road, as we start to move into managed care and value-based payments, we may start to think about scoring some of these quality metrics, against one another, so we can determine our top quartile, our bottom quartile, and assign those things a score, just like we have on the financial side of the house with Brian Cregan and John Sherman. That's a ways off. I think there's a lot of pitfalls to doing that, but it's something I think we do need to explore and move forward as we progress. So what to expect next? So the new quality improvement program manual will be sent. It will also be uploaded to the NYSARC website. We hope to have that out by the end of this week. Once we receive your data by April 30th, and you see at the bottom, we will be reporting back to you by early summer with your metrics, seeing how you did relative to last year and relative to other chapters and regional rates. We're going to continue to meet with our quality standards professional work group to discuss further refinement of some of the metrics, like the staff turnover metric, which I think we're going to tinker with a little bit and try to make it a little bit more usable for all chapters. A quick plug, our Quality and Compliance Conference is scheduled for May 2nd in Saratoga Springs. We have some great speakers from Office of Civil Rights about HIPAA. We have the director of the Attorney General's office, Mafuku, that will be coming. We have some representatives from OPWDD and some additional topics. We think it's going to be a great conference this year. And just a reminder, April 30th, the QIP attestation and data are due. Obviously, if you have that information prior to April 30th, you certainly can send it in advance of that due date. Okay, so questions and answers. Give us a second to compose ourselves and we'll look at the questions that we've received. Okay, so our first question is, will there be a requirement for an employee satisfaction survey? The answer is actually yes. In your quality improvement plan, one of the criteria that you must meet is a method for assessing the satisfaction of the employees and the workforce. We leave the vehicle for doing that, the mechanism for doing that, the survey tool, that's something that you can develop or work with other chapters to share a tool, but you have to have something that gives management feedback on how your workforce is feeling and thinking and what the general tone is. Okay. I don't see any additional questions. If you do have one and you want to type it into the question box, we'll wait another minute or two. We are also available by email or telephone as well for more detailed explanations or clarification of anything we've talked about here today. But seeing that we don't have any additional questions at this time, we want to thank you. We're going to get some materials out to you by the end of the week, and you'll be hearing from us hopefully oh, wait, we have breaking questions. We have a hand up. No, doesn't look like we have a new one.
I think there might be one right there. I might expand.
No, let's see. Okay. One question. Any update on the status of the lawsuit on the Justice Center case? Okay, I think this is the question about the Category 4 cases. For those of you, so this is a Justice Center matter. For those of you that don't recall, there was a lawsuit and it was determined that the Justice Center cannot charge a provider agency with a Category 4 allegation of abuse and neglect in cases where a target is identified. So what we found was that the Justice Center would kind of lump on additional charges, systemic charges to the provider agency. Right now, the Justice Center is not issuing any more Category 4s to any provider agencies, but they are not removing the old Category 4s until their appeal of that decision is finalized. So you shouldn't receive any more. The ones you've already gotten are still present, and depending on how the court ultimately decides that case, they may go away or they may stand. And as soon as we know anything, we will let you know.
I think there's one up above that.
How would you like us to count the residents? Okay, so the counts need to be unduplicated individuals being served in your programs. So if you have an individual who receives MSC, ResHab, some day services, or community hab, that would be counted as one individual. We would not want that counted as 4 individuals just because they're in 4 of your programs. So we do realize that this is going to be some work for your finance team and your HR department, but we are, to make this data accurate to the best of our ability, we need to get unduplicated individuals being served in your programs.
Oh, yeah, just going back up, so it's about a conversion of the ICF to the IRA. So I think it doesn't change it.
Okay, we're just looking at this last question here.
We converted ICFs to IRAs in 16.
Okay, so the question is, there's a chapter that converted ICFs to IRAs, which is a good thing, in October 2016. How would you like us to count the residents? So when you have a situation like that where there's a conversion in the middle of the year, I would do the count the same way. I would count those individuals once, whether they're in the IRA or the ICF. You certainly would not count them twice just because they're entering a different kind of residential setting. So it would just be counted as one unduplicated person. Let's say you have a 4-bed, 6-bed ICF that's converting to a 6-bed IRA. You would count for the year 6 unduplicated individuals. Okay, no additional questions. So I want to thank everyone for your time today. we will, if we haven't gotten your question or you didn't get a chance to submit it, please shoot us an email and we'll answer it offline. Thank you all, and we will be seeing you at the conference and the spring regional meetings.